All right, ladies, pay attention. An overactive bladder is not normal, but many women often just tolerate it, which can affect daily lives, right? Well, however, there are many ways to control it that does not involve surgery. Dr. Jennifer Gilby is back from Women's Care Florida and here to explain some causes. Good morning.
Good morning.
I enjoy our chats.
Well, I enjoy being here. Thank you for having me.
So let's talk about this bladder. As we've talked about some other things, I think a lot of women just tolerate it and say, oh, this is just what my body is doing with age or whatever. And
yeah. So, women incontinence, so leaking of urine and overactive bladder, are constantly felt to be, this is what's just going to happen to me. My mom had it. My grandmother had it. I just know I'm going to have to wear pads the rest of my life or go to the bathroom every 15 minutes.
And what say you?
Yeah, no.
Okay.
Not normal. And I have to re-educate patients every single time they walk in the door. They're like, oh, it doesn't bother me. I'm like, you're not sleeping through the night. You're waking up 4 and 5 times. You have to know where a bathroom is everywhere you go. That's not normal.
Yeah.
So I encourage them to, fill out a questionnaire. We talk about it. There are, you should be able to go 3 hours without having to go to the bathroom, and you should be able to sleep through the night without having to go to the bathroom. And so when it's not those things, when it's, more frequent than that, we talk about reasons.
Okay.
Why
so what are some of the most common reasons? So
what happens, the bladder becomes overactive because later in life, menopausally, or as we go through, get to, mid 40s to mid 50s, is lack of estrogen. So the lack of estrogen in the whole urogenital area really affects the bladder. There's estrogen receptors, and nobody really realizes this. So there's estrogen cream that can be applied vaginally, which can then help the bladder. It's absorbed in that area. It's directly absorbed. Over a 3 to 6 month period of time, it can resolve all symptoms. And it's used once a day at bedtime. Then there's dietary influences, things that we put in our mouth that really, really, really affect our bladder. Nobody wants to hear it, but caffeine.
I saw that
chocolate,
in the notes, caffeine.
Right.
Oh, boy.
And they don't like hearing that. But I really tell them, it's not a death sentence. This isn't forever. Your bladder's irritated right now. Let's get it healthy.
Oh, okay.
Let's remove those from your diet for 2 to 3 months. Use the estrogen cream, and you will really see a difference.
Okay.
And they truly do. If they follow my instructions, if they do as if they believe in me and believe in the therapy, they're better and they're so happy. And I really just was going to live with this the rest of my life.
So the biggest take home, do you think, is really just, because sometimes I think these are embarrassing things for women to bring up. They don't want to talk about this. But this is a safe place, I'd imagine, in your office where it's not the first time you're going to hear it. It's not the last.
No. And I try to, we have questionnaires for that reason. Because, we identify people who have these, components of their daily life that aren't normal. And we bring it up and talk to them, and you'd be amazed at how many times they're like, oh, it doesn't bother me. I'm like, no, we need to talk about this. This is not normal. So it's good, and there are ways to treat it. Even there's a lot of medications that some people might be offered first. I personally don't do that as a physician. I try a lot more of the natural ways to do it, and often end up not having to give them medication. So it's really nice, a nice way to do it, and I've seen great success with the program. And my mission is just to get the word out to women to say, don't suffer. Come talk to a physician, seek someone out that will listen to you. Get this fixed.
The good news is there are options. Well, doctor, thank you so much for spending some of your time with us this morning. We appreciate it.
Thank you.
Obviously, to find out more about Women's Care Florida, all you have to do is go to their website, and we'll make sure that gets on our website, too, so it's easy to find. Thank you so much.
Thank you.